Hantavirus is a family of viruses carried by rodents, mainly mice and rats, that can spread to humans and cause serious, sometimes fatal illness. For most strains, you do not catch it from another person. You catch it by breathing in air that contains tiny particles of infected rodent urine, droppings, or saliva. This can happen when you clean out a shed, work in a barn, or disturb a rodent nest in a poorly ventilated space. The virus becomes airborne without you ever touching the animal directly. However, one strain called the Andes virus, found primarily in South America, is the exception. It is the only known strain of hantavirus that can spread from one person to another. This happens through close, prolonged contact with a sick person, such as sharing a living space, handling contaminated bedding, or exposure to their saliva or respiratory fluids. It does not spread casually like the flu. In May 2026, this was confirmed in a real-world setting when the Andes virus spread among passengers on a cruise ship in the Atlantic Ocean. It was one of the first documented cases of Andes virus spreading, person to person, outside of a household setting, and it put health agencies across more than 20 countries on alert. Once the virus enters your lungs, it attacks tiny blood vessels called capillaries and causes them to leak. Your lungs begin to fill with fluid. This condition is called hantavirus pulmonary syndrome, and it can shut down your lungs and heart within days. Early symptoms look exactly like the flu: fever, deep muscle aches, fatigue, and nausea. Most people do not realize anything serious is wrong until 4 to 10 days later, when breathing becomes difficult and the lungs start failing rapidly. There are over 40 known strains. In the Americas, strains like Sin Nombre and Andes virus attack the lungs, and roughly half of those serious cases are fatal. In Europe and Asia, different strains attack the kidneys instead, causing a condition called hemorrhagic fever with renal syndrome, with death rates between 1 and 15%. There is no specific cure. Doctors manage symptoms, provide oxygen, and support the body while it fights. The antiviral drug ribavirin helps with the kidney-targeting strains but has not been proven effective for the lung-damaging type. Wearing a mask and gloves when cleaning areas with signs of rodents is the most effective prevention.